Welcome back, everybody. Today, we're taking a deep dive into something pretty important, but maybe not something you think about every day. We're talking about medication non-adherence and why people don't always take their medication as prescribed. We'll be looking closely at Chapter 5 from the Handbook of Clinical Psychopharmacology for Therapists to help us along the way. And get this, it's actually the top reason treatment fails, not only in psychiatry, but in general medicine as well.
It's pretty wild when you think about it. It's not as simple as just forgetting to take a pill or something. Dr. Sean Shea, he's a leading expert in this area. He talks about how patients actually weigh the pros and cons of taking medication before they decide to take it or not.
So it's like they're making a choice. But if you're struggling, like if I'm going through something difficult, why wouldn't I want to take something that could potentially help me?
Well, you have to consider the side effects. Some medications, especially some of those older antidepressants, they can come with a whole bunch of side effects, and they can be tough to handle. Imagine feeling so down that even something like having a dry mouth is unbearable. The chapter actually talks about a patient who stopped taking their meds because of that.
Wow.
And then there's that feeling of being out of control, especially for people dealing with anxiety.
So it's almost like the medication itself is like a threat.
That's a really good way to put it. On top of all of that, there are also those practical concerns that people have, like money worries. A lot of people are worried about becoming dependent on medication. And then there's the fear that the medication could even make them suicidal. And of course, we can't forget the stigma around mental health, which definitely makes people hesitate to take something that makes it seem like they have a problem.
Yeah, you start to see how complex this can be. It's not just one thing. It's a lot of different factors.
It's like a tangled web.
So with all of that being said, shouldn't a doctor be able to talk through all of this with their patient?
Well, in theory, that open communication is super important, but sometimes there can be some deeper psychological stuff going on that even the patient isn't fully aware of.
That's interesting. What kind of deeper reasons are we talking about here?
Well, there's this concept called secondary gain, where someone might unconsciously benefit from staying ill. The book actually has an example of a woman who became depressed after her husband cheated on her.
Oh, wow.
And she might, without even realizing it, she might hold on to that depression as a way to get sympathy or even punish her husband.
So it's not that she wants to be depressed, but the illness is serving a purpose.
That's right. And then sometimes, especially with people who have experienced trauma, there's this dynamic where they almost try to defeat the doctor.
Defeat the doctor?
Yeah, by not taking their medication. They're asserting control in a situation where they might otherwise feel powerless.
That makes a lot of sense, especially if they've had bad experiences with authority figures in the past. But what about people who are super sensitive to medication?
Yes.
Is there any hope for them if they're having problems with even small doses?
Absolutely. It all comes down to understanding how differently we all metabolize medications. Some people process medications really slowly, which can lead to higher levels in their system and make the side effects more intense. And in those cases, microdosing can really help. It's where you start with really tiny doses and increase them little by little.
Microdosing, I've heard that term before, but I'm not really sure I understand how it works.
It's pretty straightforward, actually. You're basically taking a fraction of a normal starting dose, something so small it might not even have any noticeable effect at first, and then over time, the doctor slowly increases the dose and checks for side effects. It's all about finding that sweet spot, where the medication is helping, but the side effects aren't too bad.
So finding that balance is really important. But that must require a doctor who's paying attention and really working with the patient.
You're right. The doctor's approach to this can have a big impact on whether the patient is successful with the medication or not. If a doctor isn't empathetic, or if they dismiss the patient's concerns, or if they don't explain things well, that can be a real problem.
Yeah, I can definitely see that. It would make the patient feel like they're not being listened to.
Exactly.
Like their experience doesn't matter.
Right. It's like they're being told to just deal with it and take the pills. It doesn't matter how they feel.
Right.
And that kind of approach doesn't help anyone. Patients have to feel like they're a part of the treatment process. They're not just following orders.
That makes a lot of sense. So we've been talking about the patient and their internal struggles and the doctor's approach. But what about those external factors, like friends and family?
Oh, yeah.
Do they ever influence medication non-adherence?
Absolutely. That can be a big factor. Imagine someone who starts taking a medication and they feel better almost instantly, maybe even before the medication has even had time to kick in.
Oh, so like a placebo effect.
Exactly.
They believe it's working, so they feel better.
That's right. But the problem is they might think that improvement is all because of the medication. So they decide they don't need it anymore. They stop taking it, and then their symptoms come right back.
That's got to be tough.
It's like thinking you won a marathon because you had a good first mile.
Yeah, that's a perfect way to put it.
And then, of course, you've got the influence of family and friends. Some people are really against taking medication. They think it's a sign of weakness or that it's not a natural solution. And that kind of pressure can be really hard on someone.
I could see how it would be tough. being torn between what your loved ones think and what your doctor is suggesting. Has Dr. Shea looked into that? Like, how to handle that kind of situation?
He has, and he says it's all about those tough conversations. Patients need to be open with their families about why they're taking medication and what it means for them.
So it's about education for both the patient and their support system, helping everyone understand mental health and how medication can help.
That's right. And sometimes, if those conversations get too difficult, family therapy can be helpful. The therapist can be someone neutral who can help everyone talk about their needs and concerns.
So it's about getting professional help when things get too complicated with family.
Yeah.
Okay. But let's think bigger picture for a second. What can we do as a society to make medication adherence better?
That's a great question, and it's something Dr. Shea thinks about a lot. He believes we need to tackle this on a few different levels. First, we need to make sure everyone has access to healthcare. Things like long wait times for appointments, expensive medications, and a lack of communication between different doctors. All of those things make it really hard for people to stick with their treatment plans.
So it's not just about educating individuals. It's about making the entire healthcare system easier to use,
Right.
more supportive.
We also need to deal with the stigma around mental illness. This needs education, awareness campaigns, open conversations that can help fight stereotypes and promote good information.
So making it okay to talk about mental health.
Ex
Like it's a normal thing.
Right, just like a broken bone or a heart problem.
Right.
And finally, we need more research, not just to understand medication non-adherence, but to come up with new solutions and interventions.
So a three-pronged approach. Improve access, fight the stigma, and do more research. It sounds like a lot, but it also gives me hope that we're moving in the right direction.
I think so too. And remember, everyone has a role to play in this. You can start by having these conversations with your loved ones, challenge those outdated ideas about mental illness, and push for better mental health resources in your community.
That's a good reminder that we can all do something. We don't have to wait for the system to change.
Right.
Okay, we talked about the patient, the doctor, family and friends, even society as a whole. But there's one piece we haven't talked about yet, the medication itself.
Ah, yes. The medication.
It's easy to think of it as just a pill to swallow, but it's more than that.
It is. It's a powerful tool. It can really change someone's life.
And like any powerful tool, it needs to be used carefully.
Exactly. And that starts with choosing the right medication for the right person at the right time. There's no one-size-fits-all solution.
So it's like matchmaking, finding the perfect medication for each person's situation.
You got it. And that means thinking about their diagnosis, their medical history, their lifestyle, what they want. It's a back and forth between the patient and the doctor, weighing the good and the bad.
It's about being on the same page, making sure the patient knows why they're taking that medication and what to expect. And I'm guessing the dosage is important too?
It is. It's not just about picking the right medication. It's about finding the right dose for each person. Some people need a higher dose, and others need a lower dose. It's about finding that sweet spot where the medication is effective, but the side effects are manageable.
It's that balance again.
Right.
And speaking of side effects, those could be a big reason why people don't stick with their medication, right?
Absolutely. Side effects can be anything from mild to severe, and they definitely play a role in whether someone keeps taking their medication. That's why doctors have to be upfront about what the possible side effects are, explain what to watch out for, and give people ways to manage those side effects.
So it's about being prepared,
Right.
not just waiting for side effects to happen,
Exactly.
but anticipating them.
And giving the patient the information and tools they need to cope.
That's right.
And remember, side effects are different for everyone. What might be a small annoyance for one person could be really tough for someone else. It's all about how sensitive each person is and how their body reacts to the medication.
So everyone's experience is unique,
Yeah,
which means that open communication between the patient and doctor is even more important.
absolutely. Patients have to feel comfortable telling their doctor about any side effects they're having. They shouldn't feel like they're complaining or being difficult. And doctors have to listen and be willing to adjust the treatment plan.
So it's a team effort. They're working together to find the best solution.
That's right. And it's not just about the physical side effects either. There can also be emotional or psychological side effects that are just as important.
Like feeling emotionally numb,
Yeah,
or having changes in mood or energy levels.
that's right. Those can be hard to describe, which is why it's important for doctors to ask the right questions and really listen to what their patients are saying.
Letting them know that their feelings are valid.
Exactly. And sometimes just a small change in the dose or switching to a different medication can make a huge difference.
It's about not giving up and working together to find what works best.
Right. And remember, medication is only one part of the puzzle. It's not a cure-all. It often needs to be combined with other things, like therapy, lifestyle changes, or support groups to really see long-term results.
So it's about looking at the whole person,
Yes,
not just their symptoms.
that's right. And that brings us to another important part of managing medication, the cost.
Oh, yeah.
Medication can be expensive, and for a lot of people, it's a barrier.
It's sad that healthcare can be so expensive.
It's a real problem, but there are things doctors can do to help.
Like what?
Well, they can try to prescribe generic medications whenever possible. Generics are usually much cheaper than brand name medications, and in most cases, they work just as well.
So it's about being smart about costs.
Exactly. And doctors can also look into patient assistance programs. These are programs that are offered by drug companies. They can give people free or discounted medications.
That sounds like a great resource.
It is. And doctors can also help patients find the best pharmacy or the best insurance plan. It can be really confusing to figure all of that out.
It sounds like the doctor's really advocating for the patient.
That's right, helping them get the resources they need.
So it's about having those open conversations about money,
Yes.
acknowledging that it can be a problem,
Exactly.
and working together to find solutions.
Absolutely. And that brings us to another important piece of this, the healthcare system itself.
So now we're looking at the bigger picture.
Exactly, because sometimes the way healthcare is set up makes it harder for people to take their medication correctly.
In what way?
Well, think about how fragmented healthcare can be. Patients often have to see multiple doctors, specialists, pharmacies, insurance companies. It can be really overwhelming.
It's like trying to solve a puzzle with missing pieces.
That's a good way to put it. And all of that can lead to miscommunication, mistakes with medication, and missed opportunities to help.
So it's not always the individual's fault.
Right.
Sometimes the system itself is making things harder.
That's right. And then you have things like long wait times for appointments, limited access to specialists, high co-pays for medication, a lack of mental health services, and not enough doctors in a lot of areas.
Wow, that's a lot of challenges.
It is, and for people who are already dealing with health problems, these barriers can feel impossible to overcome.
So what can we do about it? How do we fix a system that seems broken?
That's a tough question. I think it starts with recognizing that healthcare is a right, not a privilege.
That's a good point.
We need to invest in primary care, mental health services, and programs and communities that provide holistic care that's all connected.
So building a support system
Right.
that helps people take charge of their own health.
Exactly. We need to make it easier to access care, shorten wait times, make sure doctors are talking to each other, and make sure everyone can afford quality health care.
It's about taking away the barriers,
Right.
making healthcare accessible for everyone.
And we need to give patients more control, give them the tools they need to navigate the healthcare system, to advocate for themselves, and to be a part of their own treatment.
So it's about changing the power dynamic.
Yes.
It's not the doctor telling the patient what to do.
Right.
It's a partnership.
It's about recognizing that patients know their own lives best, and their voices need to be heard.
This has been such a great conversation. It's clear that the healthcare system has a big role to play in whether people take their medication as prescribed.
It does.
We need to address these barriers
We do.
and create a system that's fair, accessible, and puts the patient first.
A system that supports people
Exactly.
and helps them get healthy.
Okay, so we've talked about the patient, the doctor, the relationship between them, the medication itself, and even the healthcare system. But there's one more crucial element we haven't mentioned yet: research.
Yes, research is so important.
It's how we learn and make progress.
It is. In the area of medication adherence, research helps us understand why people struggle to take their medication, what challenges they face, and what interventions might work best for different people.
It's like a guide,
Right.
leading us towards better solutions.
Exactly. Researchers are always looking for new ways to understand this issue.
It's like they're detectives, looking for clues.
That's a good way to think about it. And research isn't just about getting information, it's about putting that information into practice, developing evidence-based interventions that can be used in the real world.
So taking it from the lab to the doctor's office,
Right.
to the patient's home.
And research also helps us evaluate whether those interventions actually work.
So it's a constant cycle.
It is.
We learn,
We refine.
we improve.
And it's a team effort. Researchers, doctors, patients, communities, all working together to find solutions.
So everyone has a part to play.
Exactly.
What are some of the exciting areas of research in medication adherence these days?
Well, one area that's really interesting is technology. Researchers are looking at how things like smartphone apps and wearable devices can help.
Oh, that's interesting.
They can remind people to take their medication, track their progress, and even provide personalized support.
It's like having a digital health coach.
That's a good way to think about it. And researchers are also studying the effects of different types of therapy, like motivational interviewing and cognitive behavioral therapy, to help people address the psychological and behavioral factors that lead to non-adherence.
So it's about helping people understand their own behavior
Right.
and giving them tools to cope.
Exactly. And there's also a lot of interest in the role of social support, community programs, and peer-led interventions to create a more supportive environment.
So it's about building a community
Yeah,
where people feel supported
that's great.
and they can get the help they need.
Exactly, because we're all in this together.
This has been such a great overview of the role of research in medication adherence.
It has.
It's clear that research is essential
It is.
if we want to understand this issue.
And find solutions that work.
Okay, we've covered a lot in this deep dive. We've looked at things from the patient's perspective. We've talked about the doctor's role, the importance of their relationship, the medication itself, the healthcare system, and the role of research. It's been heavy at times, but also hopeful.
I agree. The numbers on medication non-adherence can be scary. But it's important to remember that every day people are overcoming these challenges and getting great results.
It's about celebrating those successes
It is.
and remembering that there are people who care.
And resources available to help.
You're not alone in this.
That's right.
Okay, let's wrap up by talking about what we learned today. What are some key takeaways for our listeners?
Well, it's important to remember that this is more than just taking pills. It's about understanding all of the factors that can affect our choices and our behaviors. Biological factors, psychological factors, social factors, even spiritual factors.
It's about looking at the whole person.
Exactly. We talked about why it's so important to have open and honest communication between patients and their doctors and the power of a strong relationship built on trust and respect. And we talked about the need for personalized treatment plans that meet the individual needs of each patient.
So it's about working together as partners in healing.
That's right. We also talked about the barriers in the healthcare system, the stigma surrounding mental illness, and the role of research in finding new solutions.
So it's a group effort.
It is.
We all have a part to play.
And throughout this conversation, we've emphasized the importance of hope, resilience, self-compassion, and the power of community,
It's about knowing that you're not alone.
and that there are people who want to help.
So what does all of this mean for you, the listener? What can you take away from this and use in your own life or the lives of your loved ones?
That's a great question. If you're struggling with medication adherence, you're not alone. Reach out for help. Talk to your doctor, a loved one, a trusted friend.
It's okay to ask for help.
It is. And if you're a healthcare provider, think about how you approach this issue with your patients. Are you really listening to them? Are you addressing their concerns? Are you creating a space where they feel comfortable talking openly and honestly?
It's about putting yourself in their shoes
Yes.
and seeing the world from their perspective.
Every interaction is an opportunity to build trust, offer support, and make a difference.
And all of us, we need to fight the stigma surrounding mental illness.
We do.
We need to be more
Not
compassionate.
understanding.
Create a world where people feel safe asking for help without being judged.
Exact.
Mental health is just as important as physical health,
It is.
and it deserves the same level of care and attention. We also need to fight for a healthcare system that's fair and accessible for everyone,
We do.
no matter who they are or where they come from.
That's right. Healthcare is a right.
Not a privilege.
Everyone deserves to live a healthy life.
This has been such a great conversation. It's clear that medication adherence is complex,
It is.
but it's something we can work on together with compassion, innovation, and hope.
I agree. We can create a healthier and more compassionate world.
And remember, this is just the start of the conversation. We want to hear from you. What are your thoughts? What questions do you have? What are your experiences?
Your voice matters,
We believe that knowledge is powerful.
especially who it's shared.
So let's keep talking about this.
Let's keep learning and growing and working towards a world where everyone has the opportunity to thrive.
Well, that brings us to the end of our deep dive into medication non-adherence. What a journey.
It was.
We covered a lot, from individual factors to systemic barriers, from hope to the power of research. One thing's for sure, this is an issue that affects all of us.
It does.
In some way,
Whether we realize it or not.
as you go about your day, keep this conversation in mind. Notice how medication adherence, or the lack of it, might be affecting your life or the lives of the people around you.
It's about awareness
And empathy.
and breaking down the stigma
If you're interested in learning more, there are tons of resources out there.
on the internet, at your library, in your community.
Ask questions, seek support, talk to people.
Your voice matters.
Your experiences matter.
Together, we can make a difference.
Until next time, stay curious, stay engaged, and keep diving deep.
It really is, and it's not just about the physical stuff either. There can be emotional and psychological side effects too.
Oh, right, like feeling emotionally numbed out.
Exactly, or like changes in mood or energy.
Yeah,
Those kinds of things can be hard to explain sometimes. So it's really important for doctors to ask good questions and just listen to what their patients are saying.
it's about validating those experiences, right? Like letting the patient know that their feelings are real.
Exactly, and sometimes just a small tweak, like changing the dosage a little bit, or even trying a different medication can make all the difference.
It's about sticking with it and finding what works.
That's right, and it's important to remember that medication isn't always the whole answer.
Right.
It's not a magic bullet. A lot of times it needs to be combined with other things, like therapy, or making changes to your lifestyle, or even joining a support group.
It's about a more holistic approach,
Exactly, looking at the whole person.
not just treating the symptoms.
And that brings us to another important thing to consider, the cost of medication.
Oh, yeah, that's a big one.
Medications can be really expensive. And for a lot of people, that's a major barrier to taking their meds consistently.
It's sad that healthcare could be so expensive.
It is, it's a huge problem, but there are things doctors can do to help.
Oh, like what?
Well, first off, they can try to prescribe generic medications whenever they can. Generics are usually much cheaper than the brand name stuff, and they usually work just as well.
So it's about being cost conscious.
Exactly, making sure people aren't paying an arm and a leg for their meds.
Right.
And doctors can also look into patient assistance programs. These are programs run by pharmaceutical companies that offer free or discounted medications to people who qualify.
That's great. It's like a safety net.
It is, and doctors can also help patients find the best pharmacy or the best insurance plan, because that stuff can be really confusing.
Yeah, navigating the healthcare system can be a nightmare.
It can.
So it sounds like the doctor really needs to be an advocate for the patient.
They do. They need to help them get access to the resources they need.
And it sounds like those open and honest conversations about money are important too.
They are. Doctors should always talk to their patients about the cost of medication and see if there are any financial concerns and work with them to find solutions.
So it's a team effort.
It is.
Okay, so we've talked about the patient's experience, the doctor's role, the importance of their relationship, the ins and outs of medication itself. But now let's zoom out a bit and look at the bigger picture. The healthcare system as a whole.
Ah, yes, the healthcare system.
Because sometimes it feels like the system itself is making it harder for people to take their medications correctly.
It can sometimes, the way healthcare is structured, can create barriers.
How so?
Well, think about how fragmented care can be. Patients often have to see multiple providers, specialists, pharmacies, insurance companies. It can be a lot to keep track of.
Yeah, it could be overwhelming.
And all of that fragmentation can lead to problems. Miscommunication between providers, medication errors, missed opportunities for early intervention.
So sometimes it's not just about individual choices. Sometimes the system itself is setting people up for failure.
Right, and then you have things like long wait times to see a doctor, limited access to specialists, high copays for medication, a shortage of mental health services, and in some areas just not enough doctors to go around.
Wow, that's a lot to contend with.
It is, and for people who are already struggling with their health, those barriers can feel insurmountable.
So what can we do about it? How do we fix a system that seems so broken?
That's the million-dollar question, isn't it? There's no easy answer, but I think it starts with a fundamental shift in perspective. We need to recognize that healthcare is a right, not a privilege.
That's a powerful statement.
It is, and it means we need to invest in primary care, mental health services, and community-based programs that provide comprehensive and coordinated care.
So it's about building a foundation of support,
Exactly.
empowering people to take control of their own health.
We need to streamline access to care, reduce wait times, improve communication between providers, and make sure everyone has access to quality, affordable health care.
So it's about removing those barriers.
Yes.
Making healthcare a reality for everyone.
And it's also about empowering patients, giving them the information and tools they need to navigate the system, to advocate for their own needs, and to actively participate in their treatment.
So it's about moving away from that old school paternalistic model.
Exactly, where the doctor is the all-knowing authority.
Right.
And moving towards a more collaborative partnership.
Where the patient's voice is valued.
Absolutely. It's about recognizing that patients are the experts in their own lives and their perspectives are essential.
This has been such a crucial discussion about the role of the healthcare system and medication adherence.
It has.
It's clear that we need to make some serious changes
We do.
to create a system that's more equitable,
More accessible.
and more patient-centered.
A system that truly supports people on their journey toward well-being.
Okay, so we've talked about the patient's perspective, the prescriber's role, the importance of their relationship, the complexities of medication, and the challenges of the healthcare system. But there's one more piece of the puzzle that we need to discuss. The role of research.
Ah, yes. Research, the engine of progress in healthcare.
It's how we learn and grow.
It is in the context of medication adherence. Research is crucial for understanding why people struggle to take their meds, what barriers they face, and what interventions might be most effective in different situations.
It's like shining a light on a complex issue.
Exactly, helping us to see things more clearly. And research isn't just about gaining knowledge, it's about translating that knowledge into action, developing evidence-based interventions that can make a real difference in people's lives.
So it's about bridging that gap between what we know and what we do.
Absolutely, and research also helps us to evaluate those interventions, to see what works, what doesn't, and what could be improved.
So it's a continuous process.
It is of learning, refining, and optimizing.
And it's a collaborative effort.
Yes, researchers, healthcare providers, patients, and communities all working together
To find solutions.
Exactly, because we all have a stake in this.
So what are some of the exciting areas of research in medication adherence these days?
Well, one area that's really promising is technology. Researchers are exploring how things like smartphone apps and wearable devices can be used to support medication adherence.
Oh, that's interesting.
Yeah, they can be used to remind people to take their meds, track their progress, and even provide personalized feedback and encouragement.
So it's like having a digital companion
Exactly.
on your health journey.
And researchers are also investigating the impact of behavioral interventions, like motivational interviewing and cognitive behavioral therapy.
So helping people to understand their own motivations.
Right, and to develop coping mechanisms, and to strengthen their commitment to their treatment plan.
And there's also growing interest in the role of social support and community-based programs and peer-led interventions
Exactly. It's about creating a more supportive environment.
where people feel connected and empowered.
Absolutely, because we're all in this together.
This has been such an insightful look at the role of research in medication adherence.
It has.
It's clear that research is essential for moving forward.
It is for gaining a deeper understanding, developing effective interventions, and ultimately improving people's lives. Absolutely. And there's always so much more to learn and explore, isn't there?
There is, so as we wrap up this deep dive, let's take a minute to think about what we've learned and what it means for you, the listener.
I think that's important.
It's easy to get caught up in the details.
Yeah, but what does it all mean in the real world?
Exactly. So let's break it down into some key takeaways.
Sounds good.
First of all, we learned that medication adherence is about more than just remembering to take your pills. It's about understanding all of the different factors that can affect whether someone takes their medication as prescribed.
Right, like those biological, psychological, social, and even spiritual factors we talked about.
Exactly. It's about seeing the whole person, not just their illness.
And we also talked about how important that communication is between patients and their doctors.
That open and honest communication.
Exactly, where both sides feel heard and understood.
And we talked about how important it is to have a treatment plan that's tailored to the individual.
Right, one size doesn't fit all.
Everyone is different,
And we can't forget about the systemic barriers
like the cost of medication.
and the stigma around mental illness.
Those are huge factors.
They are, and that's where research comes in.
Finding new and better solutions.
It's about progress
And throughout this whole conversation, we've really emphasized the importance of hope
and resilience
and self-compassion.
and the power of community.
Knowing that you're not alone in this.
That there are people who care.
And resources available to help.
Exactly.
So if you're struggling with medication adherence,
Don't give up.
reach out to someone you trust.
Your
A
doctor,
loved
a
one.
therapist.
Anyone who can offer support.
It's okay to ask for help.
And if you're a healthcare provider, think about how you approach this issue with your patients.
Are you really listening to them?
Are you taking their concerns seriously?
Are you creating a safe space for them to open up?
It's about empathy and understanding.
And meeting people where they are.
And for all of us, let me challenge that stigma around mental illness.
Let's create a world where people feel comfortable seeking help.
Without feeling ashamed or judged.
Mental health is just as important as physical health.
And we need to treat it that way. Well, that brings us to the end of our deep dive into medication non-adherence. It's been a fascinating journey.
It has.
We've learned so much.
About the complexities of this issue.
And the many factors that play a role.
But one thing is clear.
This is something we can address together.
With compassion.
And a commitment to finding solutions.
So as we sign off, we want to leave you with one final thought. Think about what you've learned today and how it might change the way you talk about medication with your doctor, your loved ones, or even yourself.
It's a powerful question.
What we hope will stay with you as you continue to explore this important topic.
And as you navigate your own health journey.
Until next time, stay curious, stay engaged, and keep diving deep.